Blake, hey.
Mr. Kaiser, how are you this morning, sir?
Good to see you.
Good to see you. Happy New Year.
The history with Mark is that he's just very well educated, very smart, he's a visionary. But the thing that struck me always about Mark is every conversation came back to, we need to do what we can to help the community. These people need help, these people need health care, and he always came back to that. And I would get back to my office and say, hey, we got to figure out a way. We got to figure a way to help this guy get where he needs to go.
Louisiana is the 50th state in the union in terms of health status or health status of the population. We have the least healthy population in this state. That needed to be addressed. We had very limited resources to address that with.
When I think back in my own life, for many years we as a family did not have access to adequate health care because I was raised by a single mom. We didn't have health insurance. We didn't have things like that. If we needed something, if something was serious, we'd either have to go to the emergency room where she couldn't pay, and you sit there for hours, or we went to one of these health centers and you sat there for hours. It was just a terribly inefficient way to deliver health care to the community.
We strategized with the local hospital and with the Office of Public Health and the Department of Health and Hospitals of Louisiana and came up with a plan to develop what are called federally qualified health centers to replace public health units. That would be a combination of public health service and comprehensive primary care to improve the health status of the population in the local communities. And that was really the foundational idea for what is today Access Health Louisiana. Having clinics like this in the community that are responsive to the needs of the local folks, we start to make an impact on the basic health of the community. I looked at my phone and there was a text message from a fellow that lives out here in the community that had an occasion to use the facility and knows me, and said I was treated like royalty. I didn't call him and tell him that he was coming. It was the way it worked, and that's what is special and unique about the approach that we use to the delivery of services. Keith was making a presentation about wealth planning for employees and how important that is for the recruitment and retention of employees.
He came up to me, wanted to visit a little bit, and his question was, is there a way, can you help us do something to recruit and retain our providers? He came to us with a puzzle, and together, Mark and I, our teams were able to put the puzzle together, and that is to come up with a comprehensive package from start to finish on recruiting and retaining providers. And Blake, you designed this GSI DI plan for Access Health. Why don't you talk a little bit about that?
Access Health already had a really good group long-term disability plan in place. So all we did was supplement that and help their providers get to 70% of their income. That not only are they getting coverage, but it's at zero cost to them.
Most people say, wait, well, how much is coming out of my check? No, this is an additional benefit that you get for working for this company because they value your loyalty.
How has our work together
helped really with your retention?
Because we retain employees and we have more ability to attract employees, then the money that we were spending there, we can direct back into care for the folks that we're responsible for. You're practicing the best practices in evidence-based medicine. You need to do that in your financial planning for your folks. That word gets out. Then you're the employer that the talent, those that are committed, hear about you and select you as well as we select them. And that's the kind of folks that make for success.
Fruition of what Mark's dream is to be able to put additional centers in the most needy places in South Louisiana. And when I see that, I feel like we are a small part of that success, because we're able to help him in designing packages that he can then recruit these people.
To see the success of this inner city clinic has to be incredibly fulfilling for you.
It is really rewarding. I think one of the most rewarding things that I have the opportunity to experience in my job is to see the faces on the patients when they come here, and that this resource is available for them. That's really what makes a difference.